back.
We're
Hi.
back.
Welcome to Facially Conscious. We are three women here to tell you everything you need to know about skincare and medical aesthetics. So, in our first episode, we talked about where should you go first when you're looking to take care of your skin. So I am Trina. I'm a veteran esthetician here in Los Angeles for about 16 years now with my two co-hosts. We got Dr. Vicki Rappaport over here. Say hi.
Hello, everybody.
She's also been in the business for 2 lifetimes. And then we have Julie.com over here, our overly educated consumer. Hi, Julie.
Hi.
Welcome
Happy
back.
to be here. Thank you.
So today we want to talk about Botox. It's something that I think everybody's heard of, but I feel like a lot of people are confused about. And a lot of people think, should I do it?
Do I need it?
Do I need it? What is it? Some people think that Botox is fillers, but Botox is really a numbing agent, right, Vicki?
A muscle relaxer.
A muscle relaxer. So it's a
Is
muscle.
it really?
Yes.
Oh, wow. Okay.
Yeah. I mean,
You're a
let's
dermatologist,
let's
you should
just
know.
let's really. I mean, I usually start with with Julie, but I want to ask Vicki really quick because I think there's a lot of confusion around Botox because they think that Botox is a poison that you're putting into your brain, basically. And that's kind of the fear, I think, behind people getting Botox. And so I just want to first start out with saying what Botox actually is.
Okay.
And then let's talk about why people get it.
You could just
So-
dispel the myth, but I haven't heard poison in the brain. Is that
Well,
Oh.
you don't wash people's faces and you know, stare at them for hours like Trina does all day long.
right. So this is what you hear.
Well, yes, because people are like, isn't that botulism? I mean, Botox is botulism. It's basically a poison that you're injecting into your forehead,
let's
which
not
is
use
like
those
into
words.
your brain.
We're not using those words
No.
because the reps will be very angry with you. Allergan will be very angry with you.
Well, this is
No,
what
but
people say.
I know. I'm
Yeah,
just saying,
so-
but we don't want
but-
people to even hear that on our podcast.
Well, so I think a lot of people have, but it is not. Correct?
That's
Dr.
correct.
Vicki? So what is actual Botox?
Botox is a purified protein made from the bacteria that causes botulinum toxin. So you should never mistake Botox for botulinum toxin. They're very, very different. So what injectable Botox is basically a protein. You're injecting something very safe, very sterile, very vetted, very controlled. It's been around, it was FDA approved in 2002, actually when I finished my residency, perfect timing. And it's injected into very specific muscles of the face to help improve wrinkles. And it basically just relaxes the muscle. So when you know the anatomy of the face, you inject it into the specific muscle that causes the lines that the person doesn't want anymore. And you relax that muscle so the line disappears. It's FDA approved for many other things as well. But, you know, we're talking about the wrinkles today. But just so you know, it's FDA approved for axillary hyperhidrosis, which is sweating. It's approved for dystonia, neck dystonia, which is neck muscle spasms. It's approved for migraines. It's approved for bladder problems, bladder spasms. So it's basically a muscle relaxer for many medical problems.
Also like
in addition-
TMJ, right?
It's not FDA approved for that, but
Oh.
we use it for that. Yes, we
Okay.
use it for enlarged masseter muscles. It's basically become a workhorse in medicine. Truly, truly a workhorse in medicine.
And basically relaxes muscles
Correct.
for short periods of time.
That's the key, I think.
Right? So for like 3 months usually is
Yeah.
about how long it lasts?
The package insert says 3 to 4 months.
3 to 4 months.
Yes.
Okay. So, Julie.com.
Yes.
So do you use Botox, right?
I do.
Yeah. So what do you use it for?
Maybe for the vertical line that I sometimes have
In between your
in
eyebrows?
between my eyebrows.
Uh-huh. Which are called the 11s.
I've used it on top of my brows just to give a little tiny forehead lift. I think I've had it in my neck before. We were talking about that earlier. It didn't do anything for me.
I don't think you
And
had enough in your neck, but I
maybe that's
love
it.
injecting Botox in
What
the
do you
neck.
put Botox on the neck for?
Same thing, lines, the platysmal bands, these bands. Those aren't true muscles. It's more like, I mean, you inject it into the bands that help basically relax the muscle so the neck looks flatter rather than banded.
Okay.
looks flatter and more like a teenager than
Oh.
a 59-year-old woman.
Oh,
Or man.
wow.
Wow, nice.
And how much does Botox usually cost?
Oh man, that's a great question. I mean, if you go to a med spa, I've seen it down as low as like $9 a unit, and then if you do it in New York, I've seen it as high as $22 a unit. The average person gets 20 to 40 units, so you can do the math. It's anywhere from as low as like $180 for an area to $500 an area.
So if somebody was to go to somebody that was charging $9 a unit compared to $20 a unit, are they getting the same Botox?
I would hope so. It would be illegal if they're advertising they're giving you Botox and not giving you Botox. But in my,
Can they water it down?
yeah, they can. But a unit's a unit, so you really can't water down a unit anymore. I mean, you can dilute it out and do more fluid. You know, you can have basically 1 unit in a tiny amount of fluid, or you can have a unit in a lot of fluid. But it's still based on the unit is based on the price. So I always feel, and my street sense kind of comes up, is that if they're really charging $9 a unit, they're probably telling you they're doing more units than they're actually doing, because they're not making any, they're not even paying for their overhead if they're charging you $9 a unit. So and also $22 a unit is a little too expensive, but that's just the price of the New York dermatologists and plastic surgeons. I think that's a little bit too high. So ideally, yes, they should be getting the same stuff.
So you're
but
saying
sometimes
if people are charging too low, that maybe they're saying, oh, I injected 10 units, but they only injected 5?
they're not. Correct.
Oh, interesting.
I could be wrong. I hope I'm wrong. Or they're just bringing in those patients. Hey, we really are giving you 20 units, and it's $9 a unit, but we really are trying to then upsell them to lasers and things like that. So that is probably also happening.
Okay.
I don't know. Let's get the med spa owners in here one day and ask them.
Yes, because there is a big difference in pricing across even Los Angeles, that I see people charging really low and people charging really high. And it's like, does it really matter? I mean, I guess what matters is that your injector is good at what they do. Because I think some people can inject Botox and not be good at it. And
I think you're right.
And then they can make your eyebrow drop, right? And give you a lazy eye.
Yes, but it's a loaded question, because sometimes you can, have an excellent injector that will droop a brow, and it's not necessarily because they injected it wrong or poorly or weren't paying attention. It's just that some people's brows are a little labile and are droopier than others.
Oh,
Even if
and
they've done it a million times before and it's never drooped, sometimes it just actually can happen. So it doesn't necessarily reflect on how
I've also heard that you're not supposed to lay down after Botox for like 6 or 7 hours, so that the Botox doesn't move into a different area. Is that true?
Urban legend.
Oh.
So why would laying down move the Botox, but standing up wouldn't? I have no idea where that came from. I know that's what we tell patients all the time, but
Yeah,
it's
like
really
don't lay
actually
down
okay.
because you don't want have you ever got a lazy eye, Julie?
No.
No?
I've had maybe one brow that was a little higher than the other.
It happens.
Yeah.
It happens.
But they can fix that, right?
Oh, most of the time you can fix it. And that's the best part about the Botox is, God forbid something bad happens, it will always be reversible. It is not a problem.
It's
You
not
can't
a permanent thing.
And you were asking me if you can go blind with Botox. Never been seen. It's such a safe medication. I really do call it a medication. And I think that it's interesting that your clients are afraid still of it, because I feel like the generation now, the new generation, they don't have any qualms about it. They're like, I just need my Botox. I'm here. I need it. Let's do it. Okay.
Right. So, I mean, I think most people in big cities are used to Botox, and like a lot of people know what it is and a lot of people do it. But I feel like a lot of people still, even in big cities and definitely in small towns, don't even know what Botox really is. They think it's fillers, and they think that it's just another filler, where they don't know that it's a muscle relaxer. So, there's a difference between Botox and fillers. Botox just numbs a muscle. It doesn't fill any lines. It just
doesn't make
smooths
your
out
lips-
a line.
it doesn't
make your lips bigger. Some people inject a little Botox above the lip line to try and get rid of the smoker's lines. But that also can be very tricky, because then you can't suck on a straw or make kissing face. You can be slobbery if you do too much, right?
Yeah.
It's very tricky
Doing
in that
Botox
area.
in that area is like a sort of a specialized area, but it can be amazing when it's done right. But
Yeah.
you're right. You can't tightly purse your lips, so you got to be a little careful. You have to just warn the patient and talk to them about it.
Yeah.
And talking about lips?
Yes.
Yeah.
Lip Botox around the lips, not
Yeah.
injecting the lips with filler.
Yeah.
Which is a whole other thing we can talk about one
Yeah,
day.
there was a a woman I knew who was at a dermatologist's office I went to years ago, and she was doing a lot of my friends' top lip line. She was doing the vertical lines, but also giving them like a little, and it's not attractive with Botox. It's, first of all, you can't use a straw, and they all had this kind of ridge, and like, I guess you do it because you are using it still.
I love Botox in that area when it's done really, really subtly.
Yeah.
But,
I find that the softer, this is what you do for a living, so I'm not going to argue with you. I feel funny saying this, but the Restylane, the Juvederm, and all now though the new soft products.
Oh, you're talking about filler. See, we were talking about Botox.
Right, but I'm saying Botox to like lift this area.
Yeah, but if you do Botox to lift the upper lip, it does not make it look weird. It makes it look kind of beautiful. It just curls the lip up, and it's not, it's not bulking it up like, I love filler on the lips too, but it definitely is very subtle. So maybe that patient or that friend that you're talking about had fillers and Botox.
Okay, that must have been what it was.
Because Botox there is so subtle and so pretty.
Okay, that's what.
So I want to talk about something that with Botox that young people are often saying that Botox is good for prevention, and so I want to talk about that. But I want to take a quick break, and when we come back, we'll talk about like young people and Botox and this whole preventative Botox situation.
I love that.
All right, we'll be right back. We're back. Welcome back to Facially Conscious. We are talking about Botox today, and we were just touching on the subject of preventative Botox in youngins. So these young 20-something peoples. 20-something peoples.
Those millennials.
Those millennials are being told that Botox is preventative. And so people are getting Botox really young. And I feel personally, as an esthetician, and with all the research that I've had, that is not true. My opinion only, my perspective. You can believe what you want, but here's my opinion. Botox is a muscle relaxer. So people are saying, well, it's going to prevent me from getting a wrinkle. Yes, but you don't have a wrinkle. So if you don't have a wrinkle, then what are you preventing besides paying money to get Botox for a non-wrinkle? So is it true, Dr. Vicki, that if a 27-year-old comes to you and they're like, I'm starting to get a little line, I'm starting to see it, a very faint line, if you shoot some Botox in there, will that line go away?
If they're starting to have a little bit of a shadow and a little bit of a line, that line will go away with Botox.
Yes.
Right?
Okay. So that's, stop right there, because that is my point, is that if you are young, you start to see a line develop on your face slightly. If you go and pay for Botox at that point, that line goes away.
Yes.
So why would you get Botox before that?
Before a line or a shadow sounds a little overkill. You're right.
Yeah. Right.
But I don't have anybody that comes in for Botox and literally has nothing at all.
I have so many.
Wow.
Young, we are in Los Angeles, and I do see a lot of influencers.
Okay.
Young, early 20s.
Well, it makes sense. They think if this is going to get rid of lines, I'll get in front of that and use it as a preventer.
Right.
Because they're not very smart. Sorry, girls and boys out there.
Well, I think they're misled. Not that they're not smart.
Well,
I think they're misled because there's doctors and plastic surgeons and dermatologists and eye doctors and
who are willing to give them injections for money.
Your dentists and everybody who are trying to do Botox, and they're telling you like, oh, it's preventative, so you won't get lines ever. Yes, if you use Botox from your early 20s and you keep using it all through your life, you won't get wrinkles, sure. But you're also, if you're paying for it and you're not just getting it for free so that you talk about it to your fans, and you're paying for it, you're wasting your money. Because I feel like as soon as a line appears, you do Botox and the line goes away.
Yeah. And
so,
but I would say that you're not, the prevention word was coined, I believe, by Allergan, who I love because they, are a wonderful
And who's
company.
Allergan?
Allergan is a company that owns Botox, the
Right.
billion-dollar company that owns Botox. But I do believe that they coined the phrase. I don't think it was like an influencer because they
No,
did
not an
truly,
influencer.
No, I know. I'm just saying like.
I'm just saying it's marketed to young people, and that it's the influencers who are getting it for free from their doctors who are promoting it to young people.
I think you're right. That's a great. You have to remind those people out there that that's probably what's happening. But I would say that even if people are coming in for Botox at 27, they start doing Botox at 27, and they say, "I'm never going to get a wrinkle because I'm doing it early." They're still going to get wrinkles, unless they
keep
literally
doing
don't age. Don't age. If you don't keep living, you're not going to get a wrinkle. If you're
Right.
if you keep living, you're going to get wrinkles. Because there's intrinsic aging,
Right.
and of course there's aging from all the sun that we get. So
Yeah.
so even if you load up your face with Botox, trust me, 27-year-olds, you are still going to get wrinkles. So
Eventually. Yeah.
eventually, but
Well, even the 22-year-olds are getting Botox, honestly. Like, I see them of all in their 20s that are doing it, even 18-year-olds, which is weird. But they're doing it. I also think that people do it. Some people do it too much. So it's kind of trendy in Los Angeles, at least. I don't know about the other parts of the country, where people like to have the completely smooth forehead that doesn't move at all. No expression, no movement.
that's boring.
And it's become like this trendy thing that you have this like completely glass-like forehead
Well,
that
because
doesn't
the selfies
move.
look good in that situation.
Right. But you have filters now you can put on those,
That's
right?
true. Yeah.
So you don't
exactly.
really have to.
I think you're right. I think people have become a little bit obsessed with Botox, and I would say though, my youngest patient was an 18-year-old, and I
Really?
believe I think I told you guys a story in the past, but it was kind of amazing that I actually even did it. But it was a he, and he had a very deep line on his forehead, and he said that he was allowed. His parents said he could get Botox when he was 18. Of course, he's an adult.
Oh, that's
so
right.
he. And
But
I
he
was,
had a
I was-
reason for that, because
he did have
had
a reason.
really deep muscles that created this deep crease that made him look older, and also made like a valley in his face.
He had the Grand Canyon. It
Right.
was,
Yeah,
it was
that's an
insane.
unusual
And he is
circumstance.
now in his 30s, and he has been doing it pretty religiously, and he has prevented that from getting deeper and more Neanderthal looking. So in a way, there are certain people, whether it's a medical condition or whether there's just genetic predisposition, where it's appropriate.
Yeah,
But
and
you're
I
right,
mean, I
and
feel
not
like
every-
some people have a lot of movement in their forehead, a lot of muscle movement. So when they have a lot of expression and they raise their eyebrows a lot and they get those lines across their forehead or the deep fro, in between that makes them look angry. When you have that kind of muscle movement, yeah, you do it for more, it's not medical reasons, but it's because it's like creating this aged look on you when you're really young. So doing that, I think, is okay for those type of situations. But I also find a lot with men that if they have that deep wrinkle in between their forehead, that Botox alone does not help to smooth it out, that you actually have to do Botox to stop the muscles from moving in, but then you also have to fill it with a little bit of filler to kind of smooth out the valley that has created. I find that once you start feeling the valley is when you should start maybe getting a little drop.
If it
to help.
bothers you, for sure. But you're
If
right.
the valley
Sometimes
starts
if
to
it's
happen.
that
Otherwise, you
deep-
need filler in there.
Yeah,
Because
but if-
Botox is not filler. Let's remember that, people. Botox does not fill your face. So it's not going to expand any wrinkles. It's just going to smooth out what is there.
Right, relax the muscles that
Relax
cause the
them.
wrinkles. Yeah, but if people have it that deep, you can smooth it out with Botox first. And you're right, if they still have a crevice, then you go back in, a couple weeks later, and you put a little bit of filler in. That's correct.
Yeah. So go ahead.
I'm just asking about some of these actresses that we see that people say, oh, she's had too much Botox. Like, there's an expressionless face, and everything is very lifted and pulled and smooth. And
And when they smile, their eyes don't move.
Yes.
would you say that's primarily from Botox, or is that fillers too that would cause that?
It's such a great question. I think that the people who truly look really that weird, you would be surprised. That's surgical and too much filler. But too much Botox doesn't actually look, too much Botox alone, if it's just literally Botox, they look a little bit non-expressive, but they don't look weird, they don't look grotesque, they don't look like a monster. If people start looking like monsters, it's either implants, too much filler, or weird surgeries.
Okay.
And remember, these people that you see that are strange looking, not 9 out of 10 look great. It's that 1 out of 10 person that you think, oh my God, I'm never going to do Botox because I never want to look at that person. The 9 other people that you pass on the street, they have
don't
Botox.
know that they've done it.
And you don't know that they've done it because it can be really pretty and really, really subtle. But and it sounds like I'm a huge fan because I am, but I'm also a huge fan because I know as a medication, it really does help people who have other medical problems. So it's not I'm not just a fangirl because of the Botox. For wrinkles, I'm a fangirl because it really helps other medical conditions that hopefully you guys will never have to suffer with.
Yeah, I think for medical reasons it's great. I think for fine lines it's great. I think that some people overdo it a little too much, and I think if you do it too often and too much, the muscle doesn't move. You need muscle movement in order to keep that muscle kind of alive and moving. We don't want to atrophy the muscle. I've heard. I've actually had people send me their patients who completely numb their forehead and their upper eye area, that they never move their muscles because they get Botox too frequently and they never move those muscles. So they send them to me to do microcurrent so I can move the muscle for them so that it just doesn't go flat.
That's insane.
And then some people whose muscles go flat, then they have to get filler to make them look like they have a little fat in their skin. It looks really weird. Fullness. Yeah.
That's actually one of the weirdest things I think you've ever told me that you've done, to actually move the muscle for them.
Yes.
It's like people who get hooked up on machines to help move their muscles to help them work out.
Like people who are paralysis. When you're paralyzed and you can't move your muscle, the muscles go completely flat, right? Yeah. So people who've done Botox since their early 20s who are now in their late 30s who have never moved those muscles since then have this weird look in their forehead. Have you never seen this?
I have never seen that, not in my 17 years of practicing dermatology.
Well, that's why I was asking. She's saying it's not just Botox.
Yeah, maybe it's other things that they're doing as well.
That's what she was saying.
Yeah.
Because I've seen those. I know exactly what you're talking about. And everyone's first reaction is always, oh, too much Botox. But I think it is a combination of things.
Yeah, it's weird.
Somebody walked out of a dermatologist's office once. Very, very well-known actress. And oh my goodness, I don't know what was going on in there, but...
She looked weird?
Weird.
Like what?
Just done and
like a lion?
Yeah. No expression. and then it was...
Like, explain it to us.
And then it was in the media that she was looking freaky, and then she started toning it down. And I think you both know the dermatologist I'm talking about.
Ooh, who's she talking about?
I'm not sure.
We're not going to say names.
Another podcast.
Yeah. We're not going to say names.
Well, I can't. I wish I could, but I can't.
I mean, a lot of people start to look freaky when they do too much filler. The filler it looks puffy in the beginning, and then it kind of goes down in the skin. So I find that some people can look a little weird. Stop it.
Oh, that
No.
Wow.
I want to also bring up something that gets brought up to me a lot. People are showing us pictures of people who look freaky. It's kind of funny, but we're not gonna names. Okay, so oh my God, everybody stop!
Yeah, we're videotaping.
So they can't say it.
So I get clients. I'm sure you get patients, and I'm sure you've had friends ask you, "Do I need Botox? I mean, what should I do to my skin?" And I'll tell you what I tell them. I don't know what you tell them, but I want to know. But I tell people when they say to me, like, do I need Botox? I'm like, why would you ask me that? Do you think you need Botox? They're like, I don't know. Do you think I need Botox? I'm like, I'm not going to answer that. If you don't know if you need Botox, you don't need Botox. Because until you have something that bothers you, you shouldn't do anything. If something bothers you, okay, we'll address it then. If you have a specific issue that you want to deal with, we'll deal with it. But if you're asking me if I should tell you that you need Botox somewhere on your face, that's my perspective and that's my opinion, and I'm not going to put that on you. I'm not going to give you a complex.
You're a professional, so just like they might say, do I need exfoliation? Do I need
That's
brightening?
Different, though.
Why is that different?
I mean, I had a doctor one time, a very famous doctor that I went into with a client of mine, that I wanted to see what the doctor was going to say to him about his eye bags, because he's an actor and he's in films and he always gets cast as a cop or a detective on all his movies, and he's like sick of it, and he has this big puff under his eyes, which gives him that look. So he's like, I want that gone so I can get better roles, different roles. I want different roles. So I take him to this great doctor, and I'm like, I'm gonna tag along, I want to hear what he has to say. So the doctor's talking to him about what he's gonna do, and he's talking to him like, I'm gonna take the fat out, and then I'm gonna lipo it out, and then I'm gonna put a little Restylane. And then I said, why do you need to put Restylane when you're taking the fat out, where you're going to plump it back up? And he's like, well, usually when you take it out, then you have a little sunken, and then we have to do a little thing. He's like, kind of like you would do good with Restylane for your bags under your eyes. And he's like, we could do it right now if you want. And I was like, what? You just told me I have bags under my eyes. I'm like, I knew that personally.
No, but you weren't even asking.
But personally, like, I know I have that, but I'm like, people don't see that. It's just me that sees that, right? Like, I'm not going to worry about it. I'm not going to think about it. I don't want to. But
You're
he
not
brought
even
it
in there for consultation.
No,
with
and
the
he
guy.
brought it
It's
to my
terrible.
attention, and I was like, ever since then, every day since then, I sit there and I push on my lower lids to see what it'd look like if I plumped that up, and I think about it all the time. Like, should I do it? Should I do it? When should I do it? And it's been on my. It's a complex that he gave me.
Yeah, he did.
Which he shouldn't have given
He's
me.
looking to sell stuff.
Huh?
Yeah.
He's looking to sell stuff.
Right, but I think that's not right. So if somebody asks me, like, do I need Botox? I'm like, yeah, you could use a little between your eyebrows for that wrinkle.
But people are
They're
asking.
like, oh, I have a wrinkle between
but
my
people are
eyebrows? They
asking.
never knew it was there.
I get what you're saying. But
You know-
people are asking you. You weren't asking him about yourself. That's the difference. People
No,
are
but
asking you, and you're
I
a
know,
professional.
but if they don't see the wrinkle between their forehead, it's not bothering them. So if I say, you know, that wrinkle on your forehead, they're going to be like, oh, I have a wrinkle on my forehead?
but that I would imagine if I were in your position, I'm not going to tell you what to do because you're an excellent professional. And I had this time after time. I would say, what is it you think you need it for? What is it you're looking to change?
That's what I say.
Yeah, if that's bothering you, then go for it.
Right, but
That's
if they
all.
say, I don't know, I don't really have anything that bothers me,
you're
but
done.
everybody's
Then
getting
you're
Botox,
done.
so I'm thinking maybe I should do it.
No, then I would say,
Well, you're
no.
a nice voice of reason for those people,
That's
Trina,
right.
and that's why they like you. And you know,
That's
nobody
right.
quote unquote needs Botox like you need food and water. But if you're in the business of wanting really, really smooth skin and you have a little line, then yeah, you
and
need
it's
Botox.
available, and it's wonderful.
So what would you tell them? Would you say, well, if you want really smooth skin and you don't feel that you have smooth skin, you wouldn't say you don't have smooth skin. You would say, if
Here are
you
your
want really
options.
smooth skin,
tread-
maybe you would get some Botox.
I tread lightly like you because,
Yeah.
like I said, that complex that plastic surgeon gave you, I never want to give to anybody. So I really do. I try and pick their brains and see what is bothering them. Because if it is something that Botox would fix, the fix is so insane and so nice that they would be very happy. So that's what I do. I figure out what are they complaining about? What are they complaining about? Are they complaining about something that Botox can fix? If they're complaining about that, I explain to them, yes, it could. You could do really well.
But what if
with
they
it.
don't have any complaints and they're just like, should I do something? I'm thinking maybe I should do something because everybody's doing things. Like, what would you do to my skin to make me look better?
Unfortunately, I think when they ask that, they already know that they want it and they need it. They're not just like, that's not the first time they're thinking about it. So
You try and dissect what they're thinking about
yes.
and try and figure out, like,
Yeah.
what
I
are
give
their
them
issues.
And I give them options, and I mean that's what they're there for. Because truthfully, if you don't give them options and tell them what, as a dermatologist, and tell them what
Yeah.
you can give to them, they're going to go next door and they're going to get it. So
Right.
I'm happy to provide my advice and my services and what I can give to them. But I certainly wouldn't tell somebody that they would need a facelift, even if I thought they needed a facelift, because I think that's rude. I just wouldn't do it, because then they would probably end up hating their
Unless
face.
somebody
and-
said to you, can I really get enough bang for my buck with this particular procedure? Or maybe I'm looking at the next step, which would be to get a neck lift, which I'm open to doing too. And you might
if
say,
somebody
here's all of your
pointedly
options.
asks me,
Right.
I hate my neck, should I get a neck lift?
Right.
And I don't think any lasers would help. I
There
don't
you
think
go.
Botox. Of course, I would say
Yeah.
I think this is
Because
a
you're
surgical
not,
problem.
just sitting there
But I wouldn't
selling
look at
them.
their face and say, "Oh my God, you need a
yeah.
neck lift."
Yeah.
If they come
Yeah.
and ask me,
You know what I would do for you is I would lift your brow a little bit and like fill in those deep lines and like that neck. God, we got to take care of that neck with some laser.
and then $10,000 later. We'll
Yeah,
see
you
you in 6
send them
months.
out with a giant complex. They're
Oh
like,
my
I
God.
hate that doctor.
You're
They
right.
suck.
It's happened to me too.
All right, you guys. Well, I think we're going to wrap this Botox thing up. I think we kind of explained what it is, right? It's a muscle relaxer. It's not poison. Don't start too early. Only do it when you need it, when you feel like there's something on your face that you want to smooth out a little bit, or a little wrinkle. Don't wait too long, because then you'll end up with a big old divot in your brow, or some kind of a valley that then is very hard to get rid of.
Not everybody has that valley.
I know, but
Yeah.
I felt
You were
that.
doing good on the bullet points. Keep going. Keep
Okay.
going.
So anyways,
ahead, good bullet
just that's what Botox is about. So just be careful who you go to. It is about the injector. Just be careful that you go to somebody that you trust,
Agree.
a referral. Because just going to get cheap Botox from somebody doesn't mean that you're going to get a good Botox
Right,
situation.
and go slowly, please.
Yeah. Don't
Yes.
inject too much. Inject a little, see how you like it. If you need a little more, you can get a little more. If you over inject, it could cause really a weird look on your face. And if you smile with your eyes, be careful putting it in those crow's feet, because it can make you smile weird and then you look weird. That's just my opinion. All right. Thanks for joining us today on Facially Conscious. We will see you next time with a surprise. See you soon.
Bye.
Bye.
Bye.